I'm Brittany Sprague. I'm a family practice nurse practitioner that does women's health and medical weight loss at CommonSpirit Health. So I started my career in family practice, and while doing family practice, I learned that I loved women's health. And when the opportunity presented itself for me to switch to women's health full-time, I did, and I have never looked back. A couple years into doing women's health, I realized how much a person's weight affected their health, especially in women. And so I took on an additional specialty of doing medical weight loss. And it's been great doing both women's health and weight loss. What sets CommonSpirit apart is they realize the importance of preventative care and encourage patients to get all their routine screenings done because they know preventative care saves lives. My approach to patient care is giving the patients a good experience. I don't want them to ever feel like their visit is rushed. I want them to feel like we're on a team and that I'm hearing their concerns and recognizing their concerns, but ultimately leaving the decision for their care up to them. A visit with me will look different depending on what you're being seen for. So if it's a weight loss visit, then we're going to talk about your mental health, your physical health, your nutritional health, and kind of come up with a good plan for what your goals are. If you're being seen for a women's health concern, it depends if it's a preventative visit or an acute visit, but I'm going to listen to all your concerns and then we'll do an exam based on what is applicable to that visit. When I'm not at work, I'm usually taking care of my 4 adorable children. They're busy in all different activities. So I'm usually being a mom, getting them to their activities. We also love to travel as a family. We try to do a trip once a year and then smaller trips to like Bear Lake or St. George throughout the year. I also love running. So when I'm not being a mom with my kids or at work, then I'm usually on a long run.